Questions 721 to 740. 721. A patient diagnosed with septic shock had an upward trending glucose level, 180 to 225 mg/dl, requiring control with insulin. The patient's spouse asks why is insulin needed as the patient does not have diabetes. Which of the following is the most appropriate nursing response to educate the patient's spouse? It is common for critically clients to develop type 2 diabetes. We give insulin to keep glucose level under control, less than 140 mg per deciliter. B. Patient had diabetes before, you just didn't know it. We give insulin to keep glucose level in the normal range, 70 to 110 mg/dl. C. Increase in glucose is a normal response to stress by the body. We give insulin to keep the level 1 ton 140-180 mg/dt. D. Increase is common in critically ill clients and affects their ability to fight off infection. We give insulin to keep the glucose level in the normal range, 70 to 110 mg/dl. The answer is D. Increase is common in critically ill clients and affects their ability to fight off infection. We give insulin to keep the glucose level in the normal range, 70 to 110 mg/dl. 722. 33-year-old man presents to the emergency department with high-grade fever, tachycardia, and tachypnea. What is an appropriate nursing intervention for the patient's fever? A. Provide dry clothing. B. Keep limbs close to the body. C. Cover the patient's scalp with a cap. D. Measure the patient's fluid intake and output. The answer is A. Provide dry clothing. 723. A 78-year-old alert and oriented patient is returning from the radiology department and the nurse is preparing to transfer the patient from the wheelchair back into the bed. The nurse places the belt on the patient and prepares to lift the patient from the chair. Which body mechanics would be most appropriate? A. Widen leg stance. B. Bend over to lift. C. Rotate from the waist. D. Maintain base of gravity in the feet. The answer is D. Maintain base of gravity in the feet. 724. A 62-year-old male patient, admitted in the surgical ward, is scheduled for the surgical removal of polyps from his descending colon under general anesthesia. He is experiencing fatigue, abdominal pain, and blood-streaked stools for a couple of months. He is worried whether the bleeding in his stools is going to stop after surgery. What is most appropriate response by the nurse for the patient concern? A. Surgery often relieves the symptoms. B. Let us have a detailed discussion with your physician. C. Your condition may or may not resolve, it depends. D. In fact, surgery is the only treatment for the problem. The answer is B. Let us have a detailed discussion with your physician. 725. A 70-year-old male patient is brought to the emergency department on a wheelchair. He complained of drowsiness, fatigue, lack of appetite for the last 3 days. With history taking, the patient stated that he did not eliminate since 5 days and he is not ambulating a lot because he has arthritis in both knee. Why constipation is one of the common problem for immobilized patients? A. Decreased peristalsis. B. Increased colon motility. C. An increased defecation reflex. D. Decreased tightening of the anal sphincter. The answer is A. Decreased peristalsis. 726. A patient is admitted to surgical unit after the removal of foreign body from the trachea through the bronchoscopy. He is exhausted and is monitored for stability. What is the most desired outcome of nursing care? A. Presence of cough reflex and expectorant. B. Relaxed, pain-free, and easily in breathing. C. Optimum oxygen saturation at room air. D. Increase energy and activity level. The answer is B. Relaxed, pain-free, and easily in breathing. 727. A patient has undergone pericardiocentesis as part of the management of cardiac tamponade. Which of the following would be most indicative of cardiac tamponade recurring? A. Facial flushing. B. Declining heart sounds. C. Muffled heart sounds. D. Increasing blood pressure. The answer is C, muffled heart sounds. 728, a 19-year-old girl was scheduled for the extraction under general anesthesia. Her preoperative was done and the consent was signed by her, but her nail polish and trim her long nails requirement. What should be the nurse's action in response to? A. Explain why nails need to be cleaned. B. Respect the patient's right to refuse. C. Record and inform physician. D. Remove as per protocol. The answer is A. Explain why the nails need to be cleaned. 729. A nurse is caring for a pregnant patient who is diagnosed with abruption placenta. Which of the following findings of assessment would indicate a concealed hemorrhage? A. Maternal tachycardia. B. Decrease in fundal height. C. Rigid, board-like abdomen. D. Acceleration in fetal heart rate. The answer is C. Rigid, board-like abdomen. 730. In placenta previa marginalia, the placenta is found at the A. Internal cervical is partly covering the opening. B. External cervical is slightly covering the opening. C. Lower segment of the uterus with the edges near the internal cervical. D. Lower portion of the uterus completely covering the cervix. The answer is C. Lower segment of the uterus with the edges near the internal cervical. 731. An infection control nurse notices purulent exudates, redness and tenderness on the surgical wound site for few postoperative patients in a surgical unit. She discussed with the ward nurse and emphasized that wound infection after the surgery can be prevented. Which of the following is the best possible action to minimize the incidence of wound infection? A. Perform assessment of pain on the wound site. B. Wash hand before and after each patient activity. C. Encourage adequate intake and early ambulation. The answer is B. Wash hand before and after each patient activity. 732. 62. Receiving multiple mosquito bites and experiencing flu-like symptoms, patient consults a nurse at a clinic and asks whether an appointment to a healthcare provider is necessary. Which of the following statements should be the basis for the nurse's response? A. Antiviral medications can be prescribed to destroy virus. B. Clinical signs can be mild flu-like symptoms to fatal encephalitis. C. If patient has West Nile virus, symptoms will progressively worsen. D. If patient used insect repellent, virus would have been destroyed when mosquito made skin contact. The answer is B. Clinical signs can be mild flu-like symptoms to fatal encephalitis. 734. 54. Community health nurse visited a postnatal prima gravida mother who went back to work. The nurse instructed the woman the different positions breastfeeding in order to lessen the burden of the mother at night. Which of the following position will the nurse recommend for the mother night? A. Cradle hold. B. A football hold. C. Reclining position. D. Side-lying position. The answer is D. Side-lying position. 735. 45. Multiparous mother is attending at the outpatient clinic 2 weeks after her delivery for follow-up. While nurse is assessing the mother, she would not palpate the fundus. Which of the following is the most appropriate nursing action? A. Document normal finding. B. Massage the fundus to be firm. C. Assess lochia amount and color. D. Admit the mother to the hospital. The answer is A. Document normal finding. 736. What is a characteristic of an outstanding hospital vision? A. Specific in scope. B. Easily understood. C. Focused on the past. D. Kept in a private place. The answer is A. Specific in scope. 737. A 7-week-old infant boy is admitted with projectile vomiting, decreased urine output, decreased bowel movements and weight loss. He is poor turgor and appears hungry. The nurse observes left to right peristaltic waves after he vomits. The nurse would expect to find which of the following during the physical assessment? A. Hepatosplenomegaly. B. A palpable pyloric mass. C. Lymphadenopathy. D. bulging fontanelles. The answer is B, a palpable pyloric mass. 738. A woman is 5 weeks gestation diagnosed with hyperemesis GAR. What is the most important nursing action? A. Psychological support. B. Folic acid supplementation. C. Strict intake and output record. D. Providing the woman with a high-protein diet. The answer is C. Strict intake and output record. 739. A 4-month-old infant is admitted with diarrhea and vomiting. To prevent the recurrence of diarrhea, the nurse should instruct the mother to do which of the following? A. Frequent hand washing. B. Increase milk intake. C. Increase water intake. D. Change diaper frequently. The answer is A. Frequent hand washing. 740. Before administering a dose of furosemide, Lasix, to a 2-year-old with a congenital heart defect, the nurse should confirm the child's identifier by checking the hospital ID band and A. Verifying the child's room number. B. Verifying the identity with a second nurse. C. Asking the parent the child's name. D. Asking the child to tell you his name. The answer is C. Asking the parent the child's name.